Hello, welcome to Summer Series. Today we're going to be learning all about Medicaid in Medicaid 101. I'm Shea Linton and I'm excited to be talking to you about Medicaid today. So Medicaid is very useful for many purposes that can include diagnosis, treatments, medical equipment, home health care, and caregiving services. This is just a few services that are provided through Medicaid. A lot of people in the US actually are impacted by Medicaid. It is expected that around 78 million individuals are currently on Medicaid in the US. So here are listed some of the coverage groups that may be included within Medicaid. You have children, seniors, low-income adults, pregnant individuals, and individuals with disabilities. Medicaid is often known as the program with many names. So some names you may expect, such as Alabama Medicaid for Alabama. However, there are certain states that you may not realize is Medicaid. For example, South Carolina is Healthy Connections, or Oklahoma is Sooner Care. So it's just important to know that the name that you're looking for when you're trying to search up Medicaid information. Medicaid actually finances a good bit of healthcare spending within the country. So as you can see on the map, it actually makes up the third most amount of healthcare spending, with being at about 19%, with the other two being Medicare and private health insurance making up just a little bit more. We're going to explore a little bit about the history of Medicaid. So in 1965, Medicaid was established in the United States. As of the 1980s, all of the states had opted in. In 2010, the Affordable Care Act offered a pathway for Medicaid to be expanded. However, in 2012, it was decided that state expansion was optional and that the ultimate decision was given to states. But as of 2024, 41 states had decided to expand Medicaid. The federal and state government both have a very important role in Medicaid. However, their roles tend to differ just a little bit. So the federal government establishes the Medicaid minimum guidelines that states must abide by. However, states end up having the final decision on what is that coverage they offer and programs they offer within their state. They just have to follow the federal guidelines that have been set. For funding, the federal government tends to do the majority of the funding. However, the state government does offer additional funding for the program as well. Recently, you may have heard a lot about H.R. 1, also known as the One Big Beautiful Bill Act. So while the act provides specific areas to target to decrease Medicaid spending, many specific details are unknown currently. These changes will often differ between states, as each state has its own Medicaid program and gets the ultimate decision on what changes they make. Specific targeted areas include cost sharing, work requirements, and provider tax reductions. Here we're going to go over a timeline of some key changes that are expected to be seen due to H.R. 1. So right away, you'll see a provider tax freeze. This places restrictions on the ability of states to use provider taxes to raise the non-federal share of Medicaid expenditures, potentially resulting in changes to state Medicaid programs and services. In January 2026, you'll see that the Affordable Care Act marketplace tax credits will expire, which will raise premiums in marketplace plans. Also in January 2026, there will be automatic Medicare sequestration cuts will go into effect, prompting a massive decrease in Medicare funding. In October of 2026, you'll see restrictions on immigrant eligibility for Medicaid will go into effect. Also in October 2026, there will be a rural health fund that will go into effect, and this is essentially to help keep rural hospitals open. In January 2027, you'll see that this is the deadline for state implementation of the new Medicaid requirements. One of these new requirements is that Medicaid recipients will have to renew their eligibility every 6 months. New regulations will also limit retroactive coverage. Another new requirement is that there will be different work requirements that will go into effect, which will require Medicaid beneficiaries to provide evidence of employment. Specific exceptions will apply for individuals living with a disability. In October 2027, the safe harbor percentage decreases from 6% to 5.5%. This often deals with the provider tax credits that we talked about earlier in the presentation. In 2028, there will be a revised home equity limit for long-term care eligibility. Also in 2028, you'll see that the orphan drug exclusion from Medicare negotiation, meaning that it will be harder for Medicare to be able to negotiate orphan drugs to a lower price. There will also be an ability to approve new 1915 waivers for home and community-based services. And finally, there will be an implementation of cost sharing of up to $35 for specialty care. This does not include primary care or medication. For many families, Medicaid provides life-changing options that most would not be able to access otherwise. By continuing to advocate for Medicaid, we can ensure that rare disease patients' voices are heard when most impacted.